Hello and welcome once again to Hude Hour on Hude Network, where we do what we always do. We break down issues within the humanitarian and development space. My name hasn't changed. I remain Amadin Ogbewe.
And I am Joan Eze. You're welcome. Thank you so much for joining us. Hi, Amadin.
Hello, Joan. How are you doing?
I'm good. I'm well. How are you?
You look good as well.
Thank you.
I have to ask, you're looking good. Are you feeling good?
That's deep. Yeah, I'm feeling good.
Yeah, because that's why we're here today. We want to, make sure or let people know that, the physical appearance of a person might not always translate to how they're feeling. And sometimes maybe part of the mental health awareness is being able to know or ask, how are you feeling? Because sometimes when people ask that question, they could actually break down crying because they didn't even think of it themselves. And now they have to examine what's going on inside.
Yeah.
And, in reference to what's going on outside, looks can be deceiving. So let's delve deeper into it this morning. Mental health is fundamental to overall well-being. It influences how individuals think, feel, and interact within their communities. Despite its importance, mental health services remain underfunded and inaccessible to many across Africa.
Indeed, mental health is a critical part of the Sustainable Development Agenda 2030. Goal 3 emphasizes good health and well-being for all, highlighting the need for accessible and equitable mental health care as part of strong health systems.
Now, today we'll discuss the urgency of prioritizing mental health in Africa's healthcare landscape, the challenges of access and stigma, and the progress being made toward more inclusive health systems. First, our headlines. WHO urges faster action to strengthen mental health systems in Africa. Global campaign launched to address mental health crisis. And finally, Northwestern Medicine and West Health launched $8.6 million initiative for primary care. Now, we'll delve more into this and more after the break. Don't go anywhere. Around the globe, mental health challenges remain a leading cause of disability and suffering. According to the WHO, depression affects 5% of adults worldwide, and anxiety disorders impact nearly 4%. Despite this, more than 75% of people with mental health conditions in low and middle income countries receive no treatment at all.
Suicide claims over 700,000 lives annually, making it one of the leading global causes of death. It affects all age groups, with suicide ranking as the third leading cause of death among 15 to 29-year-olds worldwide in 2021. Despite this, greater investment in mental health care is urgently needed.
Now we'll unpack these issues and more as we progress. Stay with us. Now to our first news item. The World Health Organization has called for urgent action to accelerate progress in mental health care across Africa, warning that despite improvements, access to services remains limited. While investments have increased, many countries still struggle with stigma, inadequate funding, and weak integration of mental health into primary care. Between 2014 and 2020, the ratio of mental health specialists to population in Africa improved by 14%, and government spending on mental health rose from $0.10 to $0.46 per capita. Additionally, 79% of countries in the WHO African region introduced mental health training for primary health care workers by 2020. However, only 8 out of 47 countries have work-related mental health prevention programs, and just 3 actively collaborate between mental health services and labor ministries. WHO Regional Director for Africa at the time, Dr. Matshidiso Moeti, stressed the need for stronger action, stating that while progress has been made, countries must do more to ensure comprehensive mental health support. And it also says that WHO is working with the government to expand services, integrate mental health into early childhood programs in Kenya, Mozambique, and Tanzania, and promote rights-based policies in Ghana and Zimbabwe. In 2022, African nations endorsed the regional framework to strengthen the implementation of the Comprehensive Mental Health Action Plan 2013 to 2030, pushing for increased investment, policy reform, and evidence-based suicide prevention. WHO continues to support countries in making mental health a core component of healthcare systems. Well, I think this is something that has been laid the groundwork even under Dr. Mohetti. And I think looking at it from this point of view, it shows that there's already that awareness that mental health needs to be more integrated into primary care, because a lot of people can tend to push it by the wayside and say, let's not worry about that right now. There are other pressing issues. But then mental health care can have, for lack of a better word, physical repercussions. Things that happen in your head can manifest in different ways. And I think that's the importance here. We see the numbers, even though there has been progress, the spending in per capita, in budgeting, you saw that increase there, even if it's not so major. But it's also important to see how much further it can go, at least. And there was also mention of stigma. These are things that we'll also delve further when our psychologist comes in later into the picture.
Yeah, this angle of something being internal that is not, seen as a priority is a huge problem.
Yeah.
And
because people can see it.
People can see it. Just back to how you asked me, how do you feel? It's a question that someone can actually, there's this particular cliche people use, I'm fine, but actually they are not fine. So they just tell you I'm fine because maybe reasons that they don't want to bother you, or the stigma, like, why won't you be fine? Your mental health is not something that's supposed to be a problem. Like, there are other problems that we should focus on than mental health. So giving it a priority in different countries in the world, WHO pushing for it to be included in the primary health sector system is very, very, is a good step, I believe. So it's a good one from there. Let's move to the next news item we have. A global campaign to spotlight the mental health needs of healthcare workers has been launched by a collaboration between United for Global Mental Health Africa, CDC, the International Council of Nurses, ICN, and the International Federation of Medical Students Association, IFMSA. The campaign amplifies the voices of frontline and future health professionals, drawing attention to the unique challenges they face, such as staff shortages, low pay, and stressful working conditions, which have led to widespread mental health issues like anxiety, depression, and burnout. During the COVID-19 pandemic, at least 25% of health workers reported mental health struggles, and these issues persist today. Sarah Klein, CEO of United for Global Mental Health, emphasized that a thriving and mentally healthy workforce is the cornerstone of any healthcare system. Africa CDC Director General Dr. Jean Kay highlighted the importance of supporting frontline workers to maintain resilient health systems, while ICN CEO Howard Catton called for urgent action to combat workplace violence, improve pay, and expand occupational health services for nurses. Okay, one thing is to take care of the patients, and one thing is to take care of the professionals, the officials that are involved in this game. So it's very important that our doctors, our nurses, medical practitioners are also checked in the course of their duties, because when they are also there fighting for the lives of other people, their lives should also be at the front line as well. They should also be checked, because their mental health, these are people that are dishing out services. So there's this saying we usually say, that body no be firewood. So people, most of these officials, we don't need to see them as a robot. They're supposed to break down.
Indeed.
They're supposed to break down at some point.
And I think, interestingly enough, I could make the argument that they might even be more at risk. When we had the Hude Hour on drug abuse, also spoke about how some of the counselors can begin to have, illness of the mind as well, because you're exposing, or in the cause of trying to fix people, you're exposed to their own damages, so to speak. And so one medical professional, mental health or otherwise, is exposed to perhaps the issues of a multitude of persons, whereas if you're a patient, you're dealing with your issues alone. So a combination of these things is why that check needs to be there. And I believe part of the training for medical professionals is that if you are not well, you can't ensure others are well. So I appreciate that, the efforts to ensure that, okay, while we're talking about mental health, let's not forget that in the workplace, for medical professionals and others, we also need to prioritize it so that they can go on to heal others. Well, that's all we'll take for now. We'll go on a break, and then we'll bring you our final news item before we're joined by our guests. Don't go anywhere. We'll be right back. Now, Northwestern Medicine, West Health, and the Meadows Mental Health Policy Institute have announced a new $8.6 million initiative to expand access to evidence-based mental health services through primary care. The Northwestern Medicine West Health Accelerator will integrate psychiatric services into primary care practices, ensuring earlier intervention and streamlined mental health support across Northwestern Medicine's network. This effort builds on the success of the collaborative behavioral health program, which has grown since 2018 to serve patients at 75 primary care locations, with more than 59.3 million US adults experiencing mental illness in 2022, and only 15.6% receiving treatment. The demand for accessible mental health care continues to rise. This collaboration aims to create a scalable, evidence-based care model that can be replicated nationwide. The initiative will bring together expertise in primary care, psychiatry, technology to enhance patient care and develop best practices and optimize data-driven mental health interventions. Well, I think this news is important because the last two news, the first one was squarely based on Africa and, how there's need for these things to be ramped up in Africa. The second story talked about the collaborations, and also the Africa CDC was also a part of that collaboration. But this is a purely, for lack of a better word, Western issue, talking about the US. And so the issue here now is, I guess it paints the picture that if we can see that this is still an issue in a developed nation, one of the world powers, and we see the moves they are making, it's something I think we can also key into, particularly the NBIT there, where it combines people from psychiatry, people from technology and primary care, because that's pretty much the goal of our conversation here today, to see how this can be part of primary care, not something that is pushed aside to say, well, this is not a major problem now, we'll deal with it later, and it festers and festers until it becomes unbearable for the individuals involved.
It's very, very important. We've been saying this. You made a mention of something very, very striking there. That's a developed nation, a developed country is actually going through this. That's to say that if a developed country can be going through this, who is the developing country not to go through it? So it is something that, as far as human beings are concerned, all over the world, they are affected. So it's very important that mental health is placed as a priority in every sector. So that's...
Indeed. But that's how we draw close to this segment. We brought to you our headlines and our news items. We'll go on a break now. When we return, we'll be joined by a psychologist. She is the person of Jennifer Kizito. She'll be joining us to do justice to the issue of mental health awareness and building inclusive health systems that ensure mental health is part of it. Well, that's coming right after this break. Don't go anywhere. We'll be right back.
Every day,
Amazing stories of hope and tenacity unfold across the globe. On Hude Hour, we dive into these inspiring tales and discuss the vital work being done in the humanitarian and development space. Humanity has never faced a shortage of challenges, yet we rise stronger through teamwork and determination. Though these remedies are often underreported, on Hude Hour, we advocate sustainable solutions. We bring you the latest and most impactful news on how lives are being changed. We engage with young change makers and experts who provide valuable insights into relief efforts and the challenges faced by local communities through a global perspective. Join us every Wednesday by 8 a.m. on Hude Network's YouTube channel as we embark on this journey of positive change.
Hey everyone, let's face it, our world today experiences numerous challenges. And guess what? Our community isn't off the hook either. Most of the world issues are either not talked about enough or never talked about at all. But here on Timeline, we've got you covered. We dive deep into issues that affect us every day, leaving behind footprints of wisdom, knowledge, and solutions. Think of it like a roadmap that keeps you on the track for success. So buckle up, because in this new season of Timeline, we're taking another trip through the past, the present, and navigate into a more promising future. Again, we're talking solutions, people. And let's make one thing clear. This is not your average blah, blah, blah convo. This is real talk with a side of inspiration and a sprinkle of wow. I never thought about it like that. I'm your host on this impactful ride. Together, we'll tackle the tough stuff, laugh a little, and find ourselves on the path to positive change. So what are you waiting for? Season 2 of Timeline will be loaded. Let's get started. Hop in, and let's drive straight into the heart of issues shaping our world. Let's go. Oh, one more thing. Hit that subscribe button, and let's take this ride together.
Welcome back. We're still on the matter of mental health awareness. Particularly, we'll now be talking about prioritizing mental health, building inclusive health systems in Africa. To do justice to this matter, we have Jennifer Kizito. She's a psychologist and a regular friend of ours here in the studio. Welcome to the program, Jessica.
Welcome.
Jennifer,
Welcome,
how are you doing?
Thank you.
It's good to have you again.
Yeah, I'm happy to be here.
All right. So we've already sort of laid the groundwork about some of the gaps and what's missing. But as someone who's more in the field, how do you rate the progress so far as regards the inclusion of mental health into healthcare, perhaps even primary healthcare? And how much further do you think we need to go?
Currently, if we should judge the system in Africa, we would realize that we have a long way to go because mental health systems have not yet been included in what we provide for the citizens, for people, because we tilt towards, in the African continent, we tilt towards superstition and religion more than some facts. So because of this, we have challenges with mental health, including mental health care into systems, into healthcare systems have become a very, very serious issue because we've not come to a place where we have accepted mental health issue as a problem because we tend to attend to physical issues when it has to do with healthcare, things that we can see, things we can touch, things we can manage physically, more than the things that happen internally inside people. So because of that, when people tend to talk about mental health issues, it has not yet been accepted in the African continent and even Nigeria, to be specific. So because of this, there's a great challenge because even though there's an awareness campaign or awareness campaigns going on in different states, in different countries around Africa, what you realize is because we tilt towards superstition more and religion, we do not create an avenue for these things or accept mental health care or awareness campaigns more around these places.
Right, just a little to do a little bit more on that. When you say superstitions and all of
Yeah.
that, is that because my question was where do you think we are and how much further do you think we need to go, where the gap is? So when you talk about superstitions, even the WHO plan, I think that's runs between 2013 and 2030, even acknowledges the fact that in Africa, there are issues of the stigma and all of that. So can you tell us a little bit more about that, what that entails? Because it really might not be as big an issue in other parts of the world where readily people understand that mental health concerns are valid, even though you can't, see them with your eyes, the way you could see an injury or an illness and so on.
Okay, so when I talk about superstition is that we believe that or the African continent or the countries in this continent, many of us tilt towards superstition in the sense that we believe that more of these things are or spiritual issues are responsible for misbehavior. So when things happen or we see people that misbehave, we would think, first of all, that there's a spiritual issue that's going on. That's what we tilt towards more. And the stigma that comes with mental health issues. When people have mental health issues, what we would first say is that the person is mad. That's the first thing we believe. Every mental health issue is termed madness. So because we believe that madness is something that cannot be controlled, the person is uncontrollable, we can't seem to contain the person. So, and we also believe that it's a spiritual issue. There's a stigma that comes with it. We want to keep ourselves away, separate ourselves from such persons or such people so that we do not find relationship. There are families, if you walk across the streets of different, for Nigeria, for example, you would see people lying on the streets. People that are walking on the streets, they are mad, in quotes. So their families don't want that relationship because of the superstition and the stigma that comes with having mental health issues.
But is the flip side also a problem where somebody is telling you, I can't function because of the way I feel, and say, grow up, or man up, or don't be lazy, you're just, is that also a concern? Because the one you spoke about is where some clear symptoms are showing the person is erratic and you want to step away. Well, what about when the person looks completely fine, looks okay, and they say, no, we're not going to take you seriously. There's nothing like mental health here.
Exactly. And it has become a very serious issue because we are all wearing suits right now. You understand? So we can't really tell who is okay. The thing with mental health issues is that, first of all, it's a problem of the mind. We can't see the mind. So it's only when people begin to misbehave that extreme, that's when we begin to look into issues. So we have people who wear suits, walk around every day, but they are not actually okay. So in fact, when people tell you they are not okay and they are driving a very beautiful car, they're wearing a suit, you're going to be like, this guy is pretending because you think that he has everything figured out. But beyond that, there are issues that people face that are not on the surface. You just have to have closer interactions with them, talk with them. That's when you will begin to find out that maybe this person is suffering from anxiety disorder. This person is having problem with sleep. There are people that come out every day, but you don't know that they've not slept for days because there's an issue at hand, family issues, even personal issues that are underlying causing so many issues.
Okay, it's deeper than we think it is. Let's come to the angle of access and treatment. WHO said that mental health conditions can be treated at low cost, but unfortunately, there's still some gaps, treatment gaps. How has it affected individuals?
Well, just like you said, they've issued this policy or given this directive to people to provide mental health care at low cost. But because these things are not funded in different countries across Africa, there is a huge gap. I know that when these gaps exist, there are a lot of things that could happen. In psychology, there is something we call comorbidity. That's where somebody can have mental health issues, but the mental health issues lead to physical issues, or physical issues lead to mental health issues. So, take for example, I'm having anxiety issues, and then it leads to me having heart conditions or cardiac issues, because first of all, it started from the mind, but because I worry too much, because there are so many things going on in the mind, then the heart begins to take it begins to take a toll on the heart. So, and then we see the physical manifestations, and sometimes, so these are part of the things that gap in this that the gap causes. If we can't have a situation where people can access mental health care very easy, fast, and at low cost, because the issue is not just the fact that we are saying it's at low cost. It's also an issue of, will the people that are involved be able to come out and say, this is the issue, I'm facing this issue. First of all, they wouldn't want to approach mental health centers and all those things. So because of it, they stay enclosed in their spaces. When they stay in those spaces, eventually it leads to other issues. So more than we saying that mental health issue first, there are mental health issues that then lead to other issues we see around the globe. So this is part of the issues that gap in providing a low cost, low cost what again? Sorry.
Treatments.
Low cost treatment causes in
healthcare.
healthcare.
Speaking now to, we've already spoke about social cultural stigma and all of that. Let's talk about the how now. I think we've talked enough about the problems.
Okay.
How do you think this can be integrated, particularly into primary health care, and without that stigma? What methods can psychologists, psychiatrists, perhaps even medical doctors and people who are at the front line providing primary health care do to ensure that that stigma is removed while providing that service to people? Because like you mentioned, sometimes the issue is, will the people even present themselves in the first place?
I think part of the problems we have with the primary health care systems across the countries is the fact that we have not included mental health care into the primary health sector. So when we have maybe issues in, let's say there is a disaster somewhere, you would send medical operation or medical officers to those places, but you do not provide mental health care alongside, which also shows our stance on mental health. When people go to hospitals, they don't, part of the primary care system, it's not mental health. Where there are places, things happening, you don't, first of all, when you're preparing a team of people to go address the situation, part of the things we prepare for is not part of the primary care system. It's not mental health workers. They don't provide for these things. We shows first our orientation about mental health. So when people go to hospitals, they don't want to think first that the issue has to deal with their mind. They don't want to think about the fact that, okay, there's something going on inside. So the primary care system in Nigeria and across Africa has to come to the point where they begin to include mental health workers into the primary care system. Because we are not even in the tertiary care system. It's not even a tertiary care. It's far from that. It's not even something that is part of the system in most countries.
Most African countries.
So we have to come to a place where we include it in the primary care. When that happens, people become aware that this is actually a possibility. It means that, okay, I shouldn't feel stigmatized. I shouldn't feel like there is something too serious about this. It's something that is open. We can access this care at any time, at anywhere. So when people go to all those places, they go to hospitals, they go to institutions, they find themselves in situations that they can't actually coordinate themselves. What they will do is that when they get to a primary care system, they want to judge first. Is it a problem I'm having within? a problem that is without. So if we can integrate this into the primary care system, then people will have more awareness about mental health issues and how they can address it.
Okay. So, how can funding, now we're talking about funding, how it can be channeled to mental health. How can global funding priorities shift towards the structure of mental health?
Well, part of the things we'll notice that I think when I was listening earlier, one of the things we mentioned is that funds are being released for these things. So it's from the amount that is released to the allocation of funds. You would see that that's where all the issues lie. Even if these funds are allocated, do they actually get to where they ought to get to? You know that one of the things you would notice with, let me use Nigeria for an example, is that most of the mental health care sectors or clinics are usually almost privately funded. We have many wellness clinics in Nigeria, but most of them are privately funded, but not funded by the government. So people own these clinics, and that's actually one of the reasons why they are not very popular, because most of them don't have the right resources. They don't have all the resources they need, the personnel they need. You can't. It's not something to be proud about when you say you're a mental health worker. So, because these fundings are not available, are they allocated? Are they at the end of at the beginning of the year, they can say, oh, we are dishing out 100 million to healthcare system, but mental health care system, but do they get there? That's the question. Do they get there? If they get there, what are we are not seeing the effects of the funds on the system, especially in developing countries across Africa. We are not seeing things changing. The fact that the mental health care system is not changing means that those funds either don't get there or they get there, but we are not doing a lot with them.
Yeah.
So if we're not doing a lot with them, that's why we are here. That's why we are at the point. So it's not just about increasing the fundings. We should develop a system where that is very accountable. We should see that you are actually doing something with it. People should be accountable for the funds that they receive.
All right. So just a final question now. I was just going to combine it. One issue is, how do you think we can get this to the rural areas? Because obviously we can see working out in urban centers across Africa, but how does it get to the rural areas where the stigma actually persists the most? And then just to band the two questions together, how do you think technology comes into all of this? And I don't just mean for the rural areas now, overall in Africa, ensuring the inclusion of mental health into our healthcare systems. If you can just bundle it very quickly.
Okay. For rural areas, I think one of the things that we could do is campaigns, awareness campaigns. We could have healthcare professionals, mental health care professionals, go from rural area to rural area, addressing the stigmas that come with mental health. Come with people who have actually had mental health issues, and they have, from their mental health care issues, they have healed and they've become better and they have been integrated into the society. Once we can have people like that go into all those areas as examples, prototypes of things, people that have been successfully helped, they could talk to people, talk to these people, help them understand that this thing is possible, being better, that you could actually experience mental health issues and actually come out of it. And that's most of the things that we are trying to address by just healthcare systems, physical healthcare systems, can be addressed simply by tackling the mental health crisis that happens within. If we can have people actually go to these rural areas and talk about it, that's beautiful. And with the advance of technology right now, I think we should take the campaign very seriously. Or ads should be run, should be taken up like on different platforms. Part of the things like news stations should talk about, news outlets should talk about is provisions for all the systems or care systems that has been provided, that's mental health care systems that have been provided by the government or by private sectors, and then let people be aware that this is a reality. Then for the for technology, we can't underplay it because, in fact, it's already happening. There are some apps actually that are being created to help mental health crisis and the rest of them. I think there was one there's an app, Light something, yeah. That's where there are a bunch of psychologists, and then you just have to log into the app and then pick one based on ratings, the way people rate them. And then you pick one, talk with them online. You don't even necessarily have to pay. Yeah. So these are all things that are going on, and it's more advanced in developed countries. But if we can maybe include it into our system here in Africa, talk about it more, and we are going to go a long way. And also, for technology, we have systems now that are running, wellness centers that are actually taking calls currently. Yeah. You can be in the comfort of your home and make a call to them, and then a psychologist talks with you. Yeah. So these are all the things that are happening, but it's just that the awareness is not yet out there, and that's why what we are doing is very important. People can just go online and search up private clinics or government-provided clinics. The National Mental Health Association is also there that you can actually reach out to.
All right, thank you so much. It's been an enlightening one. And I also like to add, I think I know some of these apps, sometimes they have a process where you can sort of pass a preliminary stage, so they fit you with the best person that matches your particular situation. Yeah. So thank you so much for coming. We hope this advocacy and what we're doing here leads to inclusion of mental health within our health systems overall. Primary health care, to be precise.
Thank you
Thanks
so
much for coming. All right, that's how we end this segment of the program. We've been speaking with Jennifer Kizito. She's a psychologist on the issue of prioritizing mental health, building inclusive health systems in Africa. Don't go anywhere. When we return, we'll delve into our verified voices with Paul Oladipupo. Stay with us.
Every day, amazing stories of hope and tenacity unfold across the globe. On Hude Hour, we dive into these inspiring tales and discuss the vital work being done in the humanitarian and development space. Humanity has never faced a shortage of challenges, yet we rise stronger through teamwork and determination. Though these remedies are often underreported, on Hude Hour, we advocate sustainable solutions. We bring you the latest and most impactful news on how lives are being changed. We engage with young change makers and experts who provide valuable insights into relief efforts and the challenges faced by local communities through a global perspective. Join us every Wednesday by 8 a.m. on Hude Network's YouTube channel as we embark on this journey of positive change.
Hey everyone, let's face it, our world today experiences numerous challenges. And guess what? Our community isn't off the hook either. Most of the world issues are either not talked about enough or never talked about at all. But here on Timeline, we've got you covered. We dive deep into issues that affect us every day, leaving behind footprints of wisdom, knowledge, and solutions. Think of it like a roadmap that keeps you on the track for success. So buckle up, because in this new season of Timeline, we're taking another trip through the past, the present, and navigate into a more promising future. Again, we're talking solutions, people, and let's make one thing clear. This is not your average blah 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 convo. This is real talk with a side of inspiration and a sprinkle of wow. I never thought about it like that. I'm your host on this impactful ride. Together, we'll tackle the top stuff, laugh a little, and find ourselves on the path to positive change. So what are you waiting for? Season 2 of Timeline will be loaded. Let's get started. Hop in and let's drive straight into the heart of issues shaping our world. Let's go. Oh, one more thing. Hit that subscribe button and let's take this ride together.
Welcome back. If you just joined us, this is still Hude Hour, reaching right here. We have now to our segment, the Verified Voices segment. We've been joined now by Paul Oladipupo to give us what's happening and what the stakeholders are saying on this particular issue at the moment. Hello, Paul. How are you doing today?
Hi, Amadin. I'm doing very well. Are you doing good?
I am. I'm feeling good inside. I hope you are too.
Yes, I am. Joan as well. I hope you are feeling good inside.
Yeah, I'm feeling good inside and outside. Thank you so much, Paul. How are you doing?
Very well, thank you. It's good that we ensure that we all are doing good, both inside and outside. But our physical health and also our mental health is very important for us. You know, they all work hand in hand. Let's see what our stakeholders are saying today on our Verified Voices, starting with WHO, which says, work can affect mental health, both positively and negatively. It is essential to reduce risk of #mental health and create safe space, healthy work environments for all. With so much of the day spent at work, it is crucial that work promotes and protects mental health. I mean, wherever we might be working, we spend most of our day at work, you know, almost a quarter of your day you spend at work, right? And then the remaining part you spend at home or commuting from your house to work. So it's very important that if our mental health is not being maintained as it should be while at work, there are going to be issues here and there. Amadin, your thoughts on this?
Yes, work is very important. And I think, like you mentioned, interestingly enough, a lot of our time is spent at work. And also the issue of, you know, when people say 9 to 5, sometimes it also involves the time of getting ready, the commute, and getting to work and coming back. So all of that is something that should be considered. So at least when you are in the physical workplace, or even if you are working remotely, your company and all of that puts into place the necessary things to ensure that you are taken care of mentally and not just physically.
Exactly. There's actually no 9 to 5 in the real sense. It's usually from 7 to 7. That's what they say because of commute time and other things. Let's move on to the next tweet quickly. This is from UNICEF. It says, imagine a world where every child's mental health is as important as their physical health. UNICEF and partners are urging governments to prioritize mental health in every family, school, and community and ensuring children and their family gets the support that they need. #on my mind. There's a fact here saying that 1 in 7 10 to 19-year-old living 1 in 7 10 to 19-year-olds live with a diagnosed mental disorder. 1 in 7 10 to 19-year-olds live with a diagnosed mental disorder. This is just telling us how far it is. I mean, imagine out of 7 children, there's one of them. These are very young kids, actually, young adults, teenagers that are just growing, right? And we see that they've been diagnosed with mental disorder. It's a very sad one. Joan, I know you show care for children so much. So yeah, your thoughts on this?
Well, thank you so much, Paul. The first one talked about adults, and this one is talking about children. It's very important that their mental health is at the forefront, you know, as a priority. We shouldn't neglect because they are children, so they don't suffer mental health, or nothing is affecting their mental health. Because when a child's mental health is being checked gradually at every step of the way, when the child grows into becoming an adult, we have a lesser traumatic society. So That's my take for that.
Exactly. Reducing the trauma in our society is the goal, and it starts from while they are still young. Let's move on quickly to our next tweet right there. This is from therapist Mary Ann. She says, it is Men's Mental Health Awareness Month, and we are creating mental health awareness because 1 in 8 men experience mental health challenges, 1 over 5 have been diagnosed, and 40% have never spoken about it. 75% of deaths by suicide are males. Dear men, what kind of support do you need? She goes on to share a graphic there stating that it's okay to seek help when you need it. It's okay to have many feelings. Telling people that you are going through something will help you feel a huge sense of relief. And finally there, she says, mental health problems are much more common than you think. This is a very interesting one for me, and because I'm a man at first, and also it just talks about how much society sees it. It's expected as a man, you don't cry, you don't show some emotions, you don't feel sad, you don't feel down, right? And all of these things have caged men to where they are today. Some don't even speak about the problems that they go through. Anytime you ask them, how are you doing? The answer is very generic. I am very fine. Amadin, your thoughts on this?
Yeah, it's a serious issue, and I think sometimes this gives men the room to express themselves. And hopefully what we're expecting is that when they do, that safe space is given, so that when a man finally takes the effort or the confidence or the bravery to speak when others are quiet and being stoic, he shouldn't be shamed for it, and he should be allowed to express himself because he's human. And human emotions is not exclusive to any gender. So I think that's an interesting one that we can't take into account.
Exactly. There's no emotion that is gender specific. Every emotion is for everyone. So Joan, I would love to ask, how do you plan on supporting men in the society? I mean, if we should see that a man is down, someone is crying, a man is crying in your front, how will you feel? How do you plan on supporting men in the society, Joan?
I'd like to know too.
Okay, well, you actually put me on the spot there, but I don't really have a strategic plan. If it's for a woman, I can literally tell you, 1,000 ways I can. But, I think the first thing I would do is to connect him with his fellow man. I think that would help. Someone who will understand him, because maybe as a female, he might not really be open enough to tell me exactly how he feels. So maybe the first thing I would do is to connect him with his fellow gender who also understand the importance of speaking out and can help him. Then we'll take it up from there and we'll make sure that he's fine.
Okay, thank you very much, John. I think that's all I'll be able to take today on Verified Voices. It's been a lovely one, and it's important that we all support ourselves. It's important that we ensure that our mental health is being taken care of. Ensure that you see to it that your mental health is taken care of. Thank you very much for joining on Verified Voices. Over to you, Amadin.
Thank you so much, Paul.
Thank you, Paul.
It's a great one always having you. But that's our round of the program for today. Do your best out there to help someone who might be going through something. Just listen to them or talk to them or refer them to experts or the agenda, like Joan says, if that helps, whatever the case. And also we hope that our healthcare as a whole will begin to improve and we begin to see these things, and the stigma around mental health is reduced, the sociocultural practices holding it back are done away with, and we get to see a more inclusive society that caters to all. Thanks so much for joining us. This has been Hude Hour on Hude Network. Do join us once again Wednesday by 8 a.m. where we bring to you more issues within the humanitarian and development space. Have a nice day. Bye for now. I am Amadin Ogbewe.
And I am Joan. Thank you so much. Stay safe. One love. you.